Narcissistic personality disorder. Narcissistic personality disorder, one of several types of personality disorder, is an attitude in which people have a sense of self-worth, a deep need for extra attention and admiration, troubled relationships, and a lack of empathy for others. But behind this mask of overconfidence, there is fragile confidence that is at risk of less criticism. Narcissistic personality disorder causes problems in many areas of life, such as relationships, work, school, or financial matters. People with narcissistic personality problems may be unhappy and disappointed if they are not given special favors or compliments they believe they deserve. They may find their relationships frustrating, while others may not enjoy being around them. Treatment of centers for narcissistic personality disorders surrounding speech therapy, psychotherapy. Symptoms. The signs and symptoms of narcissistic personality disorder and the severity of symptoms vary. People with the disease can feel that they are too important to be true, feel qualified and in need of endless, extreme praise, expect to be seen as superior even if there is no success in it, develop success and skills, think of effective thoughts of success, power, intelligence, beauty, or a perfect partner, believe that they are superior and can only meet special people, equally manage conversations and look down on people they see as inferior, expect special kindness and unquestionable fulfillment of their expectations, use others to get what they want. You may or may not want to see the needs and feelings of others, be jealous of others and believe that others are jealous of them, be arrogant or boastful, and meet with pride, arrogance, and conceit, persevere in having all the best, for example, a luxury car or an office at the same time. People with narcissistic personality problems have difficulty managing anything they see as critical, and they can be patient or angry when they do not receive specialized treatment, have serious social problems and feel easily humiliated, respond with anger or contempt and try to lower the other person in order to make yourself look superior. You have trouble controlling your emotions and behavior, identify the major problems facing the pressure and adapt to the changes, feel depressed and angry because they are failing in perfection, feel the emotions of insecurity, shame, vulnerability, and humiliation when to see a doctor. People with narcissistic personality disorder may not want to think that something is wrong, so they are less likely to seek treatment. If they seek treatment, there may be symptoms of depression, drug or alcohol abuse, or some other mental health problem. But the visible stigma of self-esteem can make it difficult to accept and follow treatment. If you notice aspects of your personality that are often disturbed by narcissistic personality or you feel overwhelmed with sadness, consider reaching out to a trusted doctor or mental health professional. Getting proper medical attention can help to make your life more meaningful and enjoyable. Causes. It is not known what causes narcissistic personality disorders. Like personality development and other mental health disorders, the cause of narcissistic personality disorder may be complex. Narcissistic personality disorder can be linked to environment, miscommunication in parent-child relationships or excessive worship or criticism that is not in line with the child's knowledge, genetics, inherited traits, neurobiology, the link between the brain and behavior and thinking, risk factors. A narcissistic personality disorder affects more men than women and often begins in adolescence or adulthood. Keep in mind that, although some children may exhibit narcissism, this may be a normal part of their age and does not mean that they will continue to develop a narcissistic personality disorder. Although the cause of narcissistic personality disorder is unknown, some researchers think that in endangered species, overprotective or careless birth control methods may play a role. Genetics and neurobiology can also play a role in the development of narcissistic personality disorders. Problems with narcissistic personality disorder, and other possible conditions, can include relationship difficulties, problems at work or school, depression and anxiety, physical health problems, drug or alcohol abuse, suicidal thoughts or behavior. Prevention. Because the cause of narcissistic personality disorder is unknown, there is no known way to prevent this condition. However, it may help to get treatment as soon as possible for the child's mental health problems, participate in family therapy to learn healthy ways to communicate or deal with conflict or emotional distress, attend parenting classes and seek guidance from a physician or social worker if necessary. Diagnosis. Some aspects of narcissistic personality disorder are similar to other personality disorders. Also, you may have been diagnosed with more than one personality disorder at the same time. This can make the diagnosis of narcissistic disease more difficult. The diagnosis of narcissistic personality disorder is based on signs and symbols, a physical exam to make sure you do not have a physical problem that causes your symptoms, a complete psychological test that may involve completing a list of questions, terms in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. Treatment of personality disorder: narcissistic speech therapy, psychotherapy. Medications can be added to your treatment if you have other mental health conditions. Psychotherapy: narcissistic psychiatric treatment focuses on speech therapy, also called psychotherapy. Psychotherapy can help you learn to communicate well with others so that your relationships will be closer, more enjoyable, and more rewarding. Understand the root of your emotions and what motivates you to be competitive, distrustful of others, and perhaps self-defeating. Changes are aimed at helping you accept responsibility and learn to do the following. Accept and maintain genuine personal relationships and interactions with coworkers. See and accept your true potential and strength so that you can endure criticism or failure. Develop your ability to understand and control your emotions. Understand and tolerate the impact of problems related to your self-esteem. Let go of your desire for unattainable goals and conditions and gain acceptance of what you can achieve and what you can achieve. Treatment can be short-term to help you manage in times of stress or disaster, or it can be given continuously to help you achieve and maintain your goals. Often, including family members or others who are important to treatment may be helpful. Medications: no drugs have been used to treat narcissistic personality disorders. However, if you have symptoms of depression, anxiety, or other conditions, medications such as antidepressants or anti-anxiety drugs may help. Lifestyle and home remedies: you may feel protected by treatment or think it is not necessary. A condition of narcissistic personality disorder can also leave you feeling that treatment is not worth your time and attention, and you may be tempted to give up. But it is important to keep an open mind. Focus on the benefits of treatment. Stick to your treatment plan. Go to scheduled medical meetings and take any medications as prescribed. Remember, it can be hard work and you may have problems from time to time. Get treatment for alcoholism or drugs or other mental health problems. Your drugs, depression, anxiety, and stress may coincide, leading to a cycle of emotional pain and unhealthy behavior. Stay focused on your goal. Stay motivated by keeping your goals in mind and reminding yourself that you can work to repair a damaged relationship and be more satisfied with your life. Preparing for your appointment: you can start by seeing your doctor, or your doctor may refer you to a mental health professional, such as a psychiatrist or psychologist. What you can do prior to your appointment: make a list of any symptoms you experience and for how long, to help determine what types of events can make you feel angry or upset. Key personal information, including past traumatic events and any major current pressures, or medical information, including any physical or mental health conditions you may have, any medications, vitamins, herbs, or other ingredients you take, and doses. Questions you should ask your mental health provider so that you can make the best use of your appointment. Take a trusted family member or friend, if possible, to help remember details. In addition, a person with a long experience can ask useful questions or share important information. Some basic questions to ask your mental health provider include: what kind of distraction do you think I am? Can I have other mental health conditions? What is the goal of treatment? What therapies could work for me? How much do you expect my health to improve with treatment? How often will I need treatment, and for how long? Can family or group therapy help me? Are there any medications that can help with my symptoms? I have some of these health conditions. How can I treat them better together? Are there any brochures or other printed material that I may have? Which websites do you recommend? Do not hesitate to ask further questions during your appointment. What to expect from your mental health provider. To better understand your symptoms and how they affect your health, your mental health provider may ask: what are your symptoms? When do these symptoms occur, and how long do they last? How do your symptoms affect your health, including school, work, and personal relationships? How do you feel, and how do you react when others criticize you or criticize you? Do you have a close personal relationship? If not, why do you think that is so? What is your greatest achievement? What are your major goals for the future? How do you feel when someone needs your help? How do you feel when someone expresses strong emotions, such as fear or sadness? How would you describe your childhood, including your relationship with your parents? Have any of your close relatives been diagnosed with a mental health problem, such as a personality disorder? Have you been treated for other mental health problems? If so, what treatment is most effective? Do you use alcohol or street drugs? How much? Are you currently receiving treatment for other medical conditions?